which way does most blood in the systemic circuit flow to organs and why? C being in parallel, that is each organ system receives fully oxygenated blood and can be independently regulated. Absolutely correct. Okay, so that is correct. This is the way, or the way in which most of the blood in the systemic circuit is flowing, where each organ can regulate its own flow independently, so it can get more, it can get less, in parallel. All right, and the other options are wrong. So in series is wrong. In series is going to be the entire cardiovascular system, and not the systemic circuit or the pulmonary circuit. Yeah. Let's look at another question here. All right, 10 more seconds. All right, let's see. So there was a pretty even split among the answer choices here. Although narrowly, most of you selected B. But collectively, most of you selected the wrong answer. So let's see. Which valves help keep blood flowing in one direction from the receiving chambers of the heart to the pumping chambers of the heart? So essentially, which valve or valves keep blood flowing from atria to ventricle and not going from ventricle back to atria? So the correct answer is B, the atrioventricular valves. But quite a few separately selected other valves. So the pulmonary valves and the aortic valves are both semilunar valves, and those regulate the flow between the ventricle, which are the pumping chambers, and the artery that is after that ventricle. All right, that's the next vessel in flow. So the correct answer is B, atrioventricular valve. That's going to include the mitral valve as well as the tricuspid valve. Okay, mitral valve, also known as the bicuspid valve. Right, let's look at another question. Okay, final couple seconds here. So when the ventricles are contracted, what is the state of the valves? There was lots of response for A, but then some other options as well. So when the ventricles are contracted, we want to think about the function of the ventricles, right? So really break this down. They're squeezing. And if the ventricles are squeezing, they're trying to eject blood. And that is going to be in the forward direction, which is out into the artery. If it is the left ventricle, it's going to be the aorta. If it is the right ventricle, it's going to be the pulmonary artery toward the lungs. And so we want to think about what valves are going to be opened to facilitate that. So if the ventricle is ejecting blood, the semilunar valves must be opened, right? The aortic and pulmonary valves must both be open so that that blood can leave in coordination with what the ventricle is trying to do, trying to squeeze that blood out, trying to eject it. The preceding valves, which are between the atria and the ventricles, those should be closed, because if the ventricle is trying to eject, it needs to fill first. That happens through the AV valves. Then it needs to shut those AV valves so that it can eject that blood that it just filled. So it cannot eject at the same time that it's filling. So the bicuspid and tricuspid valves, which are the AV valves, must both be closed, okay? So the correct answer here would have been D, the bicuspid and tricuspid valves must be closed. If the ventricle is trying to eject blood, it cannot be filling blood from the atria at the same time. On the other hand, the semilunar valves should be open. So the aortic and pulmonary valves, which are both semilunar valves, they should be open. As that ventricle is ejecting blood, there needs to be somewhere for that blood to go, and it's through that semilunar valve and into the corresponding artery. All right, so the answer here was D, and that is what's happening when the ventricles are contracted. All right, let's look at another question here. Final 5 seconds. All right, let's see. So a lot of response for D. What is the order of vasculature from the left side of the heart to the right side of the heart? And so D is correct. It's the arteries, which are largest outgoing vessels. It's the arterioles, slightly smaller. The capillaries, much smaller and thinner. The venules are smallest veins, and then the veins, and then back to the right side of the heart. Okay, so this is the order of structures that we encounter when we leave that left ventricle and come all the way back to the right atrium. All right, so this is just a matter of fact, a matter of memorizing this: arteries, arterioles, capillaries, venules, veins, in terms of that order of structure. So it's really important to go back and look at that flow chart that we did, where we go from our left ventricle into our arteries, capillary beds, come all the way back to the right side of the heart, right atrium, right ventricle, then to the lungs, then into the left atrium, et cetera, et cetera. So think about what is being encountered in terms of the vasculature. Also think about what structures are being encountered. So where we're encountering the lungs and the pulmonary circulation versus the systemic circulation, and then write in or kind of insert the valves as well. So what valves are the blood, or what valves is the blood going through as it's making its way from left atrium, for example, to right atrium, left atrium to left ventricle, et cetera, et cetera. So be sure to illustrate that, draw that out, and do that as a way to really